And with me now to clarify some of the latest findings about the virus is Dr. Jacob Stephen, a cardiologist at Northwestern Medicine. Doctor, really appreciate your time. But rather than just talk about what's happening today, I mean, I wanted to ask you about, we hear about the tragic cases of those who've died, what they went through, and horrible as that is. But there seems to be growing evidence of long-term damage to those who survived this. What are you seeing?
Well, thank you for having me, Michael. Yes, as the pandemic is now in its fifth month, we're starting to see patients coming back who've actually recovered from the initial illness. And yes, they're having a lot of lingering symptoms. These are patients who have been confirmed COVID positive, tested negative, have some sort of immunity in their blood, and now they have persistent symptoms such as fatigue, some neurological symptoms, some difficulty breathing. So yes, I am seeing more of it, talking to my colleagues and even in my own practice.
What has surprised you most in terms of what you're seeing in those who have quote unquote recovered? What sort of things would you not have expected to be seeing?
I really would not expect to see such lingering shortness of breath, especially with light amounts of activity. I really did not expect to see this generalized weakness and fatigue weeks, even a month after the infection had resolved.
Is it surprising how apparently broad the damage can be? I mean, not only the lungs, I mean, we're hearing kidney damage, liver, heart, brain, nervous system, gastrointestinal, all of the things, all of these things were noted Friday in a review of reports about COVID patients. I mean, it's a very broad range of damage.
Yeah, I think the medical community, when the pandemic initially started, was kind of modeling it after an influenza infection, so primarily lung infections. But unfortunately, we're getting a lot of data from autopsies from the casualties of this pandemic, and what it's showing is that people are dying of systemic inflammation, systemic blood clots. It's a much more ubiquitous infection than, say, a traditional flu.
Yeah, the blood clotting in lots of organs as well. I mean, our own Chris Cuomo and also Richard Quest, they've spoken about, who had the virus, of course, they've spoken about things like balance and brain fog and so on. What are you seeing in terms of neurological impacts, even perhaps among patients who didn't have respiratory symptoms?
Yeah, I actually read the piece that Richard Quest had put in, and yeah, that's a very apropos article. That's exactly what I'm seeing. I'm seeing a lot of patients who are having just chronic fatigue, can't quite get their breath, even with very light amounts of activity, generalized weakness, a kind of a malaise feeling that just does not go away. And sure enough, the pandemic is still pretty young. We're only in its fifth month, so we don't know if most of these symptoms will eventually recover down the road. But yeah, that's exactly what I'm seeing.
Yeah, and you touched on this. I mean, we obviously, what it's showing is how much we don't know. I mean, a lot to learn, as you say. What would you like to see done in terms of getting our hands around the wider impacts of the virus and those lingering effects going forward? What sort of needs to be done to study that and sort of get our heads around it?
Yeah, I think now that we're getting a lot of data, both here in the United States and around the world, I think we should really focus on creating an international database and kind of classifying these patients so that we can get better targeted treatment for people that are infected. I don't think we have enough of an international cooperative database to start looking at these large volumes of patients that we have the benefit of studying now.
Yeah, I want to touch on this too. I'm seeing reports already of people uninsured or underinsured getting some massive treatment bills, given that the US doesn't have universal health care. I mean, are you seeing stuff like that? What could we see in terms of the financial impact on people post-treatment or with ongoing treatment needs? I mean, the US system isn't kind to people who aren't insured, and the unemployment issue is only added to that.
Yeah, I'm starting to see quite a few patients now who have ended up losing their jobs, and they're consequently losing their health insurance. I'd say it's affected the patients who have had critical illness the most, people that have been on ventilators for weeks to a month. They're going home, they've recovered, they're going home, and they're being hit with these very large bills. So I really don't see that changing until Congress starts addressing that particular focus of population to try to help them.
And just finally, what are you seeing regarding non-COVID emergencies? I mean, I guess in terms of people perhaps not seeking medical treatment when they should because they're worried about COVID, and those with other conditions, heart or whatever, perhaps having to wait to be seen. Is that a problem?
Well, when the pandemic first started, we definitely had to put off a lot of these elective procedures. So fortunately, most of them were not critical. As far as the critical cases, people were initially afraid to come into the hospital in case they contracted COVID. So they were putting off symptoms, related to heart attacks, strokes. They just weren't coming in. And by the time they just couldn't tolerate the symptoms anymore and came in, much of the damage was irreversible. So we have education programs in our system to make sure patients are vigilant about some of these symptoms and to not stay away from the hospitals. We have a lot of protections in place now. We're much better with protection to patients that are coming into the hospital, and we're better at treating, COVID at this point.
Right. Much to learn, much to be concerned about. Dr. Jacob Stephen, really appreciate it. Thanks so much.
Thank you, Michael.